Hello guys, in this video we will discuss the concept behind the severity of mitral stenosis. Usually during cardiac examination we will hear S1 and then S2 and something after S2 we call it opening snap, and then there is late diastolic murmur. Usually when the duration between S2 and opening snap is short, this will indicate that mitral stenosis is severe, and we would like to discuss this topic today. But I think to make it more simple, what I'm going to do, I'm going to discuss this concept using the volume pressure lobe with the different phases of cardiac cycle. So this will make the concept clearer. Okay, so let's go. So this will be the diagram. Usually the y-axis will indicate the pressure inside the left ventricle, and the x-axis will indicate the volume inside the left ventricle. So at this point, this is the end systolic volume, and this will be the end diastolic volume, and roughly this will be the cardiac loop. At this point, it's a mitral valve opening, and here will be the mitral valve closing. Here there's aortic valve opening, and here there's aortic valve closing. So at this point, this S1 and this will be S2. But where to find opening snap here? Before we find opening snap, we'd like to know what is the opening snap. So the definition of opening snap is actually the sudden opening of mitral valve leaflets once the pressure inside the left ventricle in the diastole falls below the pressure inside the left atrium. So to make this clearer, we will use this symbol diagram for the heart. Okay, so this is the left side and this is the right side. This will be the left atrium and this will be the left ventricle. During systole, usually the pressure inside the left ventricle is around 120, while during diastole it will be around 10. While the pressure inside the left atrium will be between 10 and 12. So in this diagram, this will represent 120, and here is the 10. So this phase in the cardiac cycle, we call it the isovolumetric ventricular relaxation, which is the initial phase in diastole. So the ventricle will relax and the pressure will drop slightly and gradually from 110 to 10. Okay, let us give an example. So let us imagine that we have a patient with mild mitral stenosis and the pressure inside the left atrium is just around 30. So when do we expect to find the opening snap? So now the blood pressure will drop gradually. So once the blood pressure just drops slightly below 30, which is around 29, we will hear the opening snap. So in this diagram, 29 will be roughly here. So here we will hear the opening snap. So we can see that there is a little bit of a space between S2 and between the opening snap. Okay, we will give another example. Imagine that we have a patient with very severe mitral stenosis and the pressure inside the left atrium is just around 70. So when do we expect to hear the opening snap? So when the blood pressure drops below 70 in the left ventricle. So when the pressure in the left ventricle is around 69, the mitral valve will open and then we will hear the opening snap. In this diagram, 69 will be around this point, and this is the opening snap. So what we can see from this diagram, when the pressure inside the left atrium is higher, the duration between S2 and opening snap is shorter. So in other words, the shorter the duration between S2 and opening snap, the more severe the mitral valve stenosis will be. So that's why the duration between S2 and opening snap is very important, because it indicates that the pressure is very high when it is very short. And this will conclude our discussion for today's topic. I think the next topic, we'll try to make it next week, and I will discuss the concept or the microbiology concept behind chronic granulomatous disease. Okay, I'll see you guys in next week. Okay, bye now.